This episode of The Benefit Whisper is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. Welcome back to The Benefit Whisper. I'm your host, Ralph Weber. Group benefits are more than just numbers on a spreadsheet. They're a tool for attracting great people and also protecting your team. That's really important. Securing your business's future, but too often benefits are used like a commodity, leaving real savings and smarter strategies on the table. Today, we're going over a topic that should make every employer stop and think. Trust. Trust in your vendors, in your contracts, even between your employees and your employer, as well as your consultants. Very, very, very important. Joining me today, I have a fabulous guest that I've been excited to have on for a long time. Ann Lewandowski, one of the sharpest minds in healthcare operations and compliance. Ann has spent years helping employers uncover what's really in their vendor contracts and what's not. She knows firsthand, and she's seen how misplaced trust can cost employers money, data, and credibility. And it's great to have you here.
It's so great to be here with you, Ralph. Thank you for the invitation. I'm so excited to have this conversation with you.
Yeah, absolutely. It's so needed. For the listeners that I'm sure there aren't a lot that don't know about you, but tell us a little bit about yourself.
So I like to say my journey in healthcare started when I was knee-high to a grasshopper. For those who have parents who have been entrepreneurs, you know that your children are essentially free work. Having recently become a mother, I fully expect my 3-month-old to help out around and all of that. But really, what's interesting to me is around the kitchen table, right? I think there's so much learning that happens and is transmitted through culture in a lot of different ways. And we can talk about how that happens in organizations as well. But in my family, the conversations around the kitchen table were about my parents' business ventures, really about delivering healthcare. And so some of the things I remember are the beginnings of the first Medicare physician fee schedule, my dad being scared about that. I remember being in the trenches of the Affordable Care Act, and actually this year is reminding me of when I was a prior authorization coordinator and quality auditor in 2013, and the plans had just gone through a really bad year in 2012. The Affordable Care
Right,
Act had finally
sure.
rolled out.
Mm-hmm.
And I remember doing all of these denials for people on Medicare Advantage who had not checked their plan. So please, if you're listening to this and you have family members that you care about and they're in Medicare Advantage, please have them check their plan, make sure that any supplemental benefits that they think that they have are truly going to be there in 2026. Much less is the plan going to be there. I saw that 200,000 people in Minnesota need to find a completely new plan because people have pulled
Wow.
out.
Yeah, no, I know there are a lot of changes, and in Medicare
Yeah.
Advantage. There were this year for 25 and even more for next year.
Yeah.
Also, there's a lot of fine print, isn't there?
Yeah.
In like the Medicare Advantage, employer group benefits, a lot of employers, especially the smaller ones that are self-funded, they have to have limits on their plan. Otherwise, they couldn't afford them. So to
Yeah.
make it affordable, they do put some limits, and sometimes there might be something else that works better for you. Maybe your spouse's plan, maybe an exchange program. So make sure you really examine it closely. I think that's super important.
Yeah, I think this all or nothing approach isn't an ideal solution for anybody, whether it's an employer or for an employee, right?
Mhm.
And I think that is really a challenge. I had a discussion with a woman on LinkedIn last night. And so I was quoted in Fierce Healthcare. An article came out about alternative funding earlier this year or earlier this week. What am I saying? And it maybe this year or this
Yeah.
week feels like a year long.
Right. Yes, it does.
So we were kind of going back and forth, and she was suggesting ICRAs were the be all and end all. And I said, hey,
Hmm.
it really depends, right? On the market, on the individual, all of these
Yeah.
things. And her position was really that ICRAs are the solution because the more people you push onto the exchange, the more robust the exchange gets. And, there are regulations and all of that. I do think that that ignores some of the opportunities in ERISA
Hmm.
that and it quite frankly ignores some of the duties of plan sponsors in ERISA that
Right.
I think Congress has rightfully not jumped in too heavily to start regulating, and
Hmm.
Department of Labor has not stepped in too heavily to start to regulate. There are some opportunities there, but I tend to get a little bit concerned when these regulations come out because often they're difficult for plan sponsors. And I think we see that with things like the changes to the Mental Health Parity Act and
Right.
the reporting there.
Yeah, absolutely. And, I share your view on ICRAs. There are cases where that's the best fit. There honestly are. A lot of small companies they don't have adequate enough participation because a lot of people have coverage through a spouse or just can't afford it. So in some cases it makes sense, but the problem that I have is number one, the individual plans are going up in cost like crazy. And for the employer, they say, okay, here's my budget. And it's whether it's $400 a month or 250 or whatever that number is, it stays constant. So from the predictability source for the CFO, I get that part. I do. But from the employee satisfaction, and in a lot of states, they only have HMOs,
Yeah.
and a lot of providers may not be a network. So ICRAs are a good tool, but they're definitely not the be all end all, in my opinion.
Yeah, and I think one of the things about ICRA is that I have a perspective on as somebody who traveled very frequently for a large corporation is they're sort of like Medicaid, they're a state specific solution. And so if you do have a workforce that travels quite a lot,
Mm.
you
Right.
need to think about how you support them.
Yes,
I
absolutely.
remember a couple of years ago calling my direct primary care as I got on an airplane. And by the time I landed, I had an antibiotic ready for me to pick up at a local Walgreens. And I could go
Mhm.
to my hotel, sleep that night, get up for an event that next day. And I think that that's really an important consideration if you're thinking
Yes.
about how to support your workforce and
Mhm.
keep them healthy.
Right. No, absolutely. And talking about these state specific things, I remember years ago there was talk about shopping across state lines and things like that, which was just a soundbite. It was a talking point, really. But the networks are important
Yeah.
because some of the big, multinational insurance, the BUCAs, as we call them, some of them have national networks, with the exception of New York, which is its own little island for some because of the New York regulations. But some of them, the network is only in that state.
Yeah.
So an ICRA might put you in a plan like that. And then if you travel, you
Yeah.
don't have a whole lot. So that's a good point. I hadn't even thought about that. That's a very good point.
Yeah.
Oh, yeah.
That's how my so one of the fun facts about me is restorative. If you've ever done Clifton Strengths, restorative is one of my top strengths.
Mm,
So I tend to see the whole and then an opportunity to fix the whole. So
yeah.
obviously, if you're going to do an ICRA and you're going to have a lot of travel, I would say consider some other solutions like a direct primary care or
Mhm.
something that can help to supplement and support your folks no matter where they are in the country.
Yes, that's a really good strategy. It's hard to think about individual plans versus group because I've been in doing the group self-funded benefits for 29 years. And again, individual does have a place, but in the marketplace, read the contract. And
Yeah.
of course, for an individual, that's pretty hard to do. And also, you brought up a good point about the fiduciary. In a self-funded employer plan, you have a plan's fiduciary that you can go to that's responsible or supposed to be, and we'll get into that in this episode. That's one of the things where trust really applies. So yesterday we were talking about something pretty simple but powerful. Employers often just trust their TPA, their PBM, um, the benefits broker, with all the scrutiny around rebates, data use. We talked about data use yesterday, plan language.
Yeah.
Blind trust, I don't think is enough anymore. What do you think about that? What do you think
I
about the
think it,
gaps?
I think it really gets back to anything, right? It's trust and verify. I think it's
Mm,
fine to trust anybody. But the reality is, if you're a planned fiduciary, you have individual liability. And personally, I don't trust anybody enough to close my eyes and hope
yeah,
that nobody's going to protect me in the way that I'm going to protect myself.
correct. Yes.
And I've had a lot of conversations with folks about this. And what I've realized is it's this lack of information. I was having sort of an upsetting conversation with an employer earlier this week, and I felt like just this wrenching in my gut.
Mhm.
These were sophisticated people. They had been doing their absolute best. They understood that just because your prescription drug goes up, cost goes up, that's not necessarily a terrible thing as long as it's driving down your medical cost and keeping things stable and you don't have people in the emergency room seeking out really expensive care. Right? All of these things are core principles of healthcare. And yet, when Kimberly Carlson was there, they started asking her, why does my Buca plan allow these very expensive and wrong charges through? And, there's a lot of debate about that. And I think the simplest answer in my mind is to start looking for the misaligned incentives. I'm sure we talked about this a lot.
Yeah,
They said,
absolutely.
if you think about Tiara Yachts, there's a case out there, and there were some interesting things that just happened this week. But their similar plan, they're on a blues plan, charges 30% to recoup overcharges. And this guy's face just sort of fell. And you
Mhm.
felt so bad for him because he just realized he was totally in over his head. And he said, well, they're designing their own incentive, right? And
Yes.
I felt the need to apologize to him and say, I'm not here to tell you you're doing the wrong things. And he's like, I don't get that from you at all. I don't know even where to start asking the right questions.
Right. No, exactly. I heard years ago from a TPA. Somebody from a TPA said, "We love it when doctors go out of network because then we have a chance to charge 30% on the discount we were able to get." And the average sort of Buka PPO discount, probably about 47% ish, according to some of the studies out there, the RAND study, et cetera. So being able to get a 47% discount and then charging 30% to get that discount, yes, that can be lucrative. That's all. Is that always outlined in the administrative services agreement, the ASA, or where can you find that, Ann?
Yeah, they really should be looking at all of their contracts, and they should also be talking with so I have a new campaign this week, a
Hmm.
Fiduciary Friday and review before you
Oh,
renew, right?
okay. Okay.
So it's really an opportunity to start with the basics. Do
Right.
you have compensation disclosures?
Hmm.
Start there. That's a really
Yeah.
great place to start looking. A friend of mine saw my message around because it came out that this particular group was also paying the Blues plan a per employee per month fiduciary fee. And they admitted they didn't know what this fiduciary fee was for. Because my question was, hey, do you have like this very sophisticated quasi HR person? I forget her exact title, but she wasn't even sort of the head of HR. I
Mhm.
said, hey, do you have a fiduciary committee supporting you, right? Because she shouldn't be in charge of this all by herself. She should
Right.
have some shared responsibility. And she's like, we pay Blue Cross Blue Shield a fee for that. And I was like, okay.
Isn't isn't that like the fox guarding the hen house?
Yeah. So what's interesting about the Tiara Yachts sort of
Mhm.
counterclaims that came out is they actually are alleging. So Blue Cross Blue Shield is now alleging that Tiara Yachts has as much liability because they're a quote co-fiduciary. And my friend who's a lawyer, HD Nations, would say you cannot outsource or, sort of dilute your fiduciary responsibility.
Right.
Ultimately, as an employer, as a decision maker, you can't outsource it, period. So
No, exactly.
if check your plans, see if your broker is getting compensation. A friend of
Mhm.
mine said that she was often offered that as compensation, and it was easy money
Mhm.
as a broker. So
Right.
yeah,
Yeah. Absolutely. The CAA is supposed to protect you, but as you say, trust but verify. You have to make sure you verify,
Yeah.
to get that. So for a CFO or HR leader, even CEO that may be listening, what's the first sign that the trust may be actually misplaced?
Well, I think if you start to see a compensation disclosure where you only see the money from the plan is probably a start to be a yellow or orange flag,
Hmm.
because what I've heard often is brokers will say, well, we have this compensation, we have overrides. Actually, a good friend of mine was just telling me about a case where the broker only disclosed compensation from the plan, and she started pushing them, saying, so you don't get overrides, you don't get any of this other stuff. Well, yes, but we can't attribute that to a specific plan. Of course you can.
Yes.
Sorry.
Yeah.
Of
Yeah.
course you can.
Sure.
And you know that when you're selling these products, you're attaching them to a plan and you're
Hmm.
getting compensation. So I think that's sort of the first sort of blush. I
Hmm.
think the second blush is if you start asking questions, and this came up in this discussion with this particular plan sponsor. Hey, we want to speak with the stop loss people and understand how the rating is. If you're not allowed to do that, that also becomes a red flag.
Right.
Or if you start asking a lot of questions, and I think it's one thing for a broker to say, hey, I don't have the answer right now,
Hmm.
because that actually to me shows that they're interested in getting you the right answer,
Yeah,
not just
exactly.
a response that you're looking for.
Right. Right.
But if they don't come back to you or really answer that, it
Hmm.
starts to become a problem. So I guess what
Yeah.
are your thoughts as somebody who's been in the industry for quite a while?
Yeah, no, I agree that it's hugely important. Some of the red flag, you talked about not attributable. Some of these big multinational brokerage houses, they get bonuses from some of the big carriers, and it's based on their whole block of business with that carrier. And that bonus might be 1%, 3%, 5% of the total premium that they place with that company. So if the company as a whole is placing X number of dollars with Blue Cross, with United Healthcare, with Aetna, with Cigna, et cetera, and it falls below that threshold where it goes from a 5% to a 3% bonus, they're going to say, oh, we're really close. And I've actually heard from somebody years ago that was with one of these big firms that said we would get pressure from our sales director saying, hey, we're about to slip down to the 3% level. So you got to push this company this month. And they are really misaligned incentives, Anne, because then you're not doing what's in the client's best interests. You're doing, again, attributable. If you have a plan, let's say the premium is $6 million dollars and there's a 5% bonus, that's 300,000 a year in undisclosed compensation. And yes, it's because of the whole block of business, but if you remove 6 million, then you're also removing that.
And I think you can also divide up, right? Like if you're getting a bonus, it's 3% based on, however much, how
Mhm.
much this individual plan is placed with that business. That becomes a pretty easy calculation.
Right. Yes.
We were talking earlier about your brilliant mathematical mind. I'm sure listeners didn't hear it, but I'm sure you could come up with that number pretty quickly.
Yeah. 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 I was just before I spoke to you, I was doing some calculations on what does the hospital actually get from a plan. And it was very eye-opening. And that'll be a separate discussion once I finish that. But it's amazing. Now, also yesterday, and we were talking about employee trust.
Yeah.
Employees have to trust their employers. That's a tough question. You actually talked to me about somebody taking a risk assessment and, you said that, she didn't trust where the health data was going, how it was being used. Do you want to talk about that a little bit?
Yeah, so I think this is one of those areas that it becomes very dicey for employers, because then you're acting as both plan sponsor, so you need to follow the HIPAA guidelines. Please have a HIPAA officer. Reach
Mhm.
out to me. I'm doing some fun stuff in that space, while also sort of considering and having your employer hat on and understanding how much things are going to cost. So a friend of mine started texting me this week, hey, my employer's looking for all of this data and they're asking me to go to LabQuest to do these quote free labs. What
Hmm.
do I do about it? And I was like, so you mean for like a health risk assessment? She's like, yeah, I guess.
Hmm.
So first of all, we can start to unravel that the communication to her has not been very good, sort
Hmm.
of the where, what, how, why, what's in her interest to do this. Are
Hmm.
you potentially going to give somebody HSA dollars to seed it? What exactly is going on? And so clearly, because of this lack of communication, there's some start to be mistrust. And she does have a chronic health condition that is very complex, can be challenging to manage. And I think she's scared that there's the potential that she would be outed at work or somebody would sort of profile her based on her health status.
Right, right. Yeah, no, that's definitely reason to be concerned. I have one employer group that I think they do a very good thing. What they say is as long as you're getting an annual physical, we're going to discount your contribution by about 30%. All you have to do is get one. We don't care what they say because we feel that getting that annual physical is going to catch things early. So those are some good incentives, good ways to do that. But as you know, to your point, you have to be sure that the risk assessment isn't affecting those kinds of things.
Well, yeah. And then I think there's also this whole concept of wellness plan litigation that
Hmm.
is a really hot topic that I think a lot of people are missing.
Hmm.
So, what's happening there is plaintiffs' lawyers have figured out that people going into a smoking cessation wellness program don't necessarily have their contribution discounted after completing the program.
Hmm.
Now, I think what happens is employers think that somebody has to cease smoking, but what the language seems to say, based on some of the settlements, right? I'm not a lawyer, so I can't really interpret in
Hmm.
quite the same way. But what we start to see is settlements sort of across the board with these because the discount didn't apply after the people had completed it. So I think actually the program that you're describing with a physical generally
Hmm.
without any strings attached
Hmm.
is actually the perfect wellness program, right?
Right.
Because you can only make somebody go through the wellness program. You can't really say because you didn't lose the weight, because
Yeah.
you didn't quit smoking, you don't get this discount. At least that seems to be sort of the status of the law right now.
Right, exactly, and there was so much under the ACA about wellness, and then all of a sudden, all of these vendors, just like the EMR vendors, they all sprang up out of nowhere, but there was no consistency. They were just, like, all over the board with no guarantee of results. You know, they just wanted a sort of a piece of the action to add a little bit more cost.
Well, and I mean, I think this is a really interesting question, right? Can
Mhm,
you require results? Or, is a wellness vendor just sort of a coach hoping to coach towards better behavior without any guaranteed outcome or results? And I think that raises some really interesting questions for fiduciaries who are required to think about total cost and be prudent with company dollars and, employee contributions. So, yeah, I think that's going to be an interesting area of the law that's going to evolve, I think, in the next couple of years as we see these lawsuits continue.
yeah, absolutely. They are, I mean, you know, there's 3 of them that I know about right now, but there will be more. Right now, most of them have been just on the PBM space, but I think there will be more on the other well, Tierra Yachts was one of them, but
Yeah. So I counted the number of wellness lawsuits at the beginning of this year, and there were 14
really?
against plan
Wow.
sponsors. So it's actually an underappreciated risk that a lot of plan sponsors are not facing. And like I said, some of them have already gone into settlement. So they're processing them extremely rapidly. And I would actually anticipate that I checked in January. And so I would probably anticipate we're probably up to 20 or 24 at this point.
Wow. That's a
Yeah.
lot. And this has been a great conversation. There's so much more that we need to talk about. And it's one that gets right into the heart of trust and how it's lost and hopefully rebuilt in our industry. But before we wrap up, if people want to connect with you or follow your work or learn more, how would they do that?
Yeah, so I'm available at hcrebelalliance.com or Ann at hcrebelalliance.com. Or you can find me on LinkedIn, and that's LinkedIn /Ann Lewandowski.
Okay, very good. Excellent. So, for those listening, if this episode made you think differently about your vendors, about your contracts, or how you handle employee data or share it, then please share this episode with your friends, other CFOs, HR people. And you can catch every episode of The Benefit Whisperer at benefitwhisperer.com or wherever you listen to podcasts. I'm Ralph Weber, and thank you for joining us, and we'll see you next time. Thank you very much, Ann, for being here today.
Thank you.